Metabolic dysfunction is the inability to process the energy from food, and this often ties to insulin resistance, poor mitochondrial function, and hormonal imbalances. Now, what are some common symptoms of metabolic dysfunction? Well, these symptoms can include fatigue or low energy, especially if you are feeling this in the afternoon or after meals, weight gain, especially around the core regions, even if you are making a good effort to watch the calorie intake that you are taking in, difficulty losing weight, even on a diet, and you are sticking to your plan and you are finding it difficult to lose weight, then you can have some metabolic dysfunction symptoms. And having frequent sugar cravings. So, one of the things that clients might often talk about is constantly craving sugar. Now, if you are in this position where even if you are fed and you are craving sugar, then this can be a sign of metabolic dysfunction. Another factor that I would think about too is whether or not you can be on a low carb diet and still have energy. Now, when I say that, make sure that you are also eating a higher fat intake, but metabolic flexibility is the ability to switch back and forth between carbohydrates and fats for energy. So a sign of metabolic dysfunction would be if you have to eat carbohydrates to have energy and you cannot have energy on a lower carb, higher fat intake, then you might be having some symptoms of metabolic dysfunction as well. So metabolic dysfunction is important to maintaining optimal health, and that is something that we want to focus on through nutrition and exercise to help ourselves age properly.